Disruptive events, like pandemics, leadership turnover, or natural disasters, are not rare. They can shake us, or, with the right tools, they shape us. It's how we prepare and how we communicate. When the COVID-19 pandemic disrupted nearly every aspect of work, organizations that applied the total worker health competencies were better equipped to respond swiftly and thoughtfully. From transparent communication about changing health guidelines to flexible work policies, empathetic leadership, and coordinated efforts with health experts and community partners, these organizations built trust when it was needed most. And even now, as some workplaces continue to recover, the lessons learned are still shaping how we respond to disruption. Let's take a look at the 6 total worker health competencies and how strong communication weaves through every one, helping us stay grounded, connected, and resilient during these times of uncertainty. When disruption hits, communication becomes more than a skill, it becomes a lifeline. In moments of crisis or rapid change, communication and dissemination are not just tools, they're survival strategies. They help people understand what's happening, what to expect, and what they can do. But communication isn't just about pushing out messages. It's about creating clarity, consistency, and connection, especially when everything else feels uncertain.
In the early days of the pandemic, it felt like everything changed by the hour. We were all flooded with mixed messages. No one knew what to follow.
At our company, we tried something different: daily, personalized emails from our VP of People. These weren't cold updates. They were thoughtful, steady, and full of heart.
I actually looked forward to those emails. They helped me feel like someone had our backs. I stopped relying on hallway rumors and started trusting the leadership.
Once we saw the impact, we made transparency a leadership priority. Our team started communicating more and more honestly.
Programs launched during disruption can either empower or frustrate. When disruption strikes, even the best intentions can fall flat if programs aren't thoughtfully planned and clearly explained. Program planning, implementation, and evaluation is about more than just launching new initiatives. It's about asking the right questions. What do people really need right now? How will this affect different teams? And how will we know if it's working?
In the beginning, some of our safety protocols sparked confusion. Mask policies were inconsistent, and some folks didn't understand why rules varied between departments. We learned quickly clear policies are only half the battle. People need to understand the why behind them. We tied our policies directly to CDC guidance and local data. We offered vaccine incentives and clearly explained how and when policies would shift. The result? Less pushback, more trust, and better outcomes.
In uncertain times, people don't expect leaders to have all the answers. But they do expect empathy, consistency, and presence. In times of disruption, all eyes turn to leadership. Employees aren't just looking for direction, they're looking for steadiness, empathy, and a sense that someone is truly in it with them. Leadership and management, as a total worker health competency, goes far beyond policies and planning. It's about how leaders show up, especially when the pressure is on.
We had to rethink how we showed up. With staffing stretched thin, our team focused on being flexible and human first.
My manager didn't always know what was next, but she listened. That made all the difference.
And that difference mattered. Our turnover stayed lower than most because of one thing: leadership that cared.
When disruption strikes, people want to feel heard, not just managed. That's where advocacy and engagement come in. This total worker health competency reminds us that the best policies aren't just made for employees, they're made with them. When people are invited into the decision-making process, they're more likely to understand, support, and follow through on what comes next.
At the start, our company struggled. COVID policies felt top-down, and people didn't feel included in decisions.
So, we listened. We opened feedback channels, hosted town halls, and adapted our approach based on what we heard. We learned fast. Policies had to reflect real-life experiences. So we added flexibility to sick leave and vaccination options.
I didn't feel pressured. I felt supported. I could make decisions about my health without worrying about penalties.
That sense of autonomy, it built trust and brought people back into the conversation.
Disruptive events affect everyone, but not always in the same way. Warehouse workers, field crews, remote teams, office staff, each group faces unique challenges. That's why partnership building and coordination is so important. This total worker health competency is about breaking down silos within an organization and beyond it. It's about recognizing that no one team can carry the weight of a crisis alone. Whether it's coordinating across departments or joining forces with external partners, collaboration allows us to pool resources, share knowledge, and move forward together.
Our team quickly started producing face masks and shields. At first, it was just for us. But when we had extras, we donated them to nearby hospitals.
That small act grew into something powerful. A collaboration between our company and local healthcare institutions. This wasn't just about safety supplies, it was a reminder when we coordinate, we care for our people and our communities.
Disruptive events bring uncertainty. And without expert guidance, fear fills the gaps. Subject matter expertise, one of the core total worker health competencies, helps organizations stay grounded in science, facts, and professional insight when things are most uncertain. It's not about having all the answers, it's about knowing where to turn for the right ones.
In our company, we leaned into expertise early. We brought in health consultants, updated policies based on CDC guidance, and had our leaders model the changes. We didn't try to have all the answers ourselves. We let the experts guide us, and our teams appreciated that. With trusted voices leading the way, we reduced anxiety and kept people focused on what they could control.
Disruption isn't a matter of if, it's when. But how an organization weathers that disruption depends on what it's already built. Companies that practice the total worker health competencies consistently, not just during a disruptive event, but every day, are better prepared when the unexpected happens. Why? Because the systems, relationships, and trust are already in place. Communication flows more easily. Programs are more adaptable. Leaders are more attuned to their teams. And employees already feel seen, supported, and engaged. When these competencies are part of the foundation, disruption doesn't disappear, but it becomes more manageable, less chaotic, and far less damaging. Because when your team is connected, even disruptions can become a catalyst for something better. Want to learn more? Click here to explore how organizations navigated disruption through the lens of total worker health.